Engaging the client in collaborative work is essential for the success of cognitive therapy. And of course, it's also extremely important to begin as you intend to go on. What we're going to focus on here is demonstrating ways of starting sessions that will engage the client and set the scene for joint work, which you'll then be able to do throughout your work as a therapist. There are going to be 3 sections. What we're talking about here. We're going to think about setting an agenda, about starting a session when there's a problem with difficulty with the relationship, and about starting the work of the session. And all of these are going to be illustrated using a video demonstration of the work, using the same client. So we'll follow the same client through the therapy. And here's the first section, starting with setting an agenda. Now, of course, the principles of setting an agenda are the first things we need to consider. It's always said in cognitive therapy, every session should start with setting an agenda. No way out. You have to do it, and it's surprising how many people, experienced or otherwise, forget. And then the second point, it needs to be done collaboratively. This sets the scene for all of the rest of the working. So let's just think what happens when you come into the room with somebody. It's certainly very often necessary to set people at their ease and to feel comfortable yourself and to pick up from where you left off when you're working with somebody. So people do tend to ask questions like, how are you today? But that can be a big mistake because it starts people telling you, answering that question, how are you today? And then you have the problem of thinking about how to interrupt them. So alternatively, we need to think about how to set an agenda. We need to start with that without actually a lot of small talk first, because that changes the whole style of what you're doing. So let's think about the purposes of setting an agenda, so that one can be entirely convinced that what you're doing is exactly the right thing. So the main first purpose is to ensure that the time is well spent. If you know what you're going to be spending the time on, then it's easier to divide it up. And it's easier to be sure that actually you're paying attention to the things that really are relevant and important at this time for this person. And then it's important to provide structure. Most people who have problems also get muddled, they get confused, they have difficulty deciding which is the most important thing to focus on. They don't have the theory behind them in order to decide which of those things. So as a therapist, part of our job is going to be to provide that structure. And then we need to be able to let that structure slide between sessions so that you can make links between what happened last time, what might be going to happen next time, and there's a sense of flow through the therapy. And by setting an agenda, you're modeling as a therapist something that you hope that your client is going to pick up and learn to use whenever they have problems to solve, an organized approach to problem solving. And then the point that is the theme of this particular teaching session, to engage the patient in a collaborative and open enterprise. So they're doing the work as well as you're working along together. Now, the agenda includes all sorts of things. Usually there are some standard items, and sometimes people don't bother to write these down. Once you're into therapy, people recognize these items, so you don't need to put them down or to declare them each time. Then you have the main topic or topics, and those are the things that it's really important to define. Then the session and the agenda setting usually ends with homework setting, what is the person going to do between now and when the next time that you meet, and getting feedback on how the session went. Now, one of the things that people forget when they're setting an agenda is that you need to bear the cognitive formulation in mind, because what we're trying to do here is find out which are the most important things to spend your time on. And without an idea of how the problem fits together, what the thoughts and the feelings and the behaviors really are, and how the processes that are maintaining the problem are continuing to work in that way, it's difficult to select for the agenda. So we'll come back to that point later. Here's some examples of the standard items. Of course, you always want a review. We need a review of the time period since you last met, and that may include information about how somebody's feeling, about recent events, about things that people have done in between. You may want to have some reflections on progress so far. I think it's important to keep in touch with how people feel they're doing, whether you're working along the right lines together, and to get people's reactions to your questions to that without prompting them. So this, at the beginning of the session, is a really good time to do that. Then we need to talk about the homework that people did, so you need to know what happened in their work towards the therapy in between the sessions, set new homework, and reflect together on how the work has gone today, what worked and what didn't work. So those are the standard items, and there are a number of common problems that we need to think about when setting an agenda. The first one is forgetting. Experienced people forget, inexperienced people forget, and we get sidetracked. We think we know what people want to work on, we think they know, they come in telling us what they want to work on, and we get down to work straight away, feeling busy and productive. But we're actually missing those opportunities for organising our work. Then there are problems about the way people talk. Talking too much, talking too little, for instance. Some people just come in rabbiting on, and it's really hard to interrupt them. It's really hard to focus them. It's really hard to know exactly what they want to talk about. Others have very little to say. So you ask them what they want to talk about, and they say, don't know. Or they refer to you as the expert, and they say, you tell me, I don't know what we should be doing next. And these are things that, as a clinician, one needs to develop one's own way of resolving. You'll see on the demonstration some of the things that happen that may help. Another of the problems is that the things that people put on the agenda are not always clear. They're not specific enough, or they're a bit vague. So try to make the items as clear as you possibly can. And then when it comes to working through the agenda, the main difficulty, of course, is that we stuff too many things on there, and we can't actually cover as many things as we'd like to. Probably one or two main items is enough. And if there are an awful lot, then it's worth negotiating with the person as to which ones to leave for a back burner, which ones to leave for another time. Of course, as a therapist, one's problem there is not to lose the list. Put it somewhere safely that you can put your hand on quickly the next time. As you go into the session, then the problem of getting sidetracked often comes up. People go off at tangents. As a therapist, you may lose your way for a minute or two. And then what I think what we try and do is to use what I call signposts. What I mean by that is say, hang on a minute, have we lost our way? What were we talking about then? What was the topic in our minds? So you actually set the scene again and come back to where you thought you were. Presuming, of course, that it was a sidetrack. Sometimes people discover that what you put on the agenda is not nearly as important as something else that came to mind. And then you really need to use your signpost in a different way. So then what you might be saying is something like, it sounds as if we've actually hit on something that's far more important. Shall we leave the agenda aside and stick with that? What would you like? So what I'm suggesting here is that when you're using your agenda, you actually pay attention to it. And if you stray off it, you use a signpost. You say so, rather than just sliding into something else without saying so. Now we're going to be following Ellen through a number of demonstrations. So I'm just going to introduce her to you so that you have a bit of background information. Ellen is 57. She's come to treatment because she has GAD, depression and low self-esteem. She has quite a complex set of problems, and they've been with her for a very long time. She complains most of all about being a worrier. The GAD part of the problem is the bit that's on her mind at the moment, but she actually has a history of having been neglected very severely by both of her parents in childhood and being criticised by both them and her teachers at school. She used to spend an awful lot of her time trying not to upset people, and so that they wouldn't actually be criticising her, with the result that she's always paid attention to meeting other people's needs. So there are a lot of long-standing patterns. And you need to know the personnel, because in the videos that we're going to watch, Ellen talks about them. So Ellen's husband is called Derek. Her son, their son, is called Tom, and he's just come back from university to live with them for a while. He's not found work yet. Tom's girlfriend is called Janice, and Ellen's boss is called Sarah. And now we're going to watch the video of setting the agenda with Ellen, and we're not right at the beginning of therapy, we're in session 3, so she's familiar with the process, and I don't have to explain it to her.
Oh, it's been a really grim week. I went back into work after the holiday, and they just didn't seem to realise what it had been like before I went off. So I've just been worrying all the time. And all the stuff that I'd got to do before I left, that had all piled up. So I got all that to face. And it's just meant, it just meant that all the things that were on my mind before I went off, they're just still on my mind there. And they just don't seem to have made any, they don't seem to have taken any account of the fact that I had the break because I was feeling that things were getting on top of me. Right. So that's been a worry. And then when I got home, Tom was just as bad as he had been. And he's got his girlfriend moved in just for the next 2 weeks. So even when I get back from work, there's that pressure, because he just seems to think that he can just use the house as he did before when he lived there, and obviously he can't because he's really moved out, and I just don't seem to be able to, get across to him, or he doesn't seem to realise that the pressure on me just makes it really difficult. It makes it really difficult for me to get away from the worrying at all. Mm-hmm. So there's that pressure as well.
It sounds to me as if there are really important things there that you're talking about. Do you know what you want to focus on for today?
Well, the work thing, it seems to be at work that they, whatever I'm trying to do, mm-hmm. and I really am trying to get through this stuff, because I know it's my job, and I know I've got to do the work which Sarah can't manage. I mean, I know that's what my job is. Mm-hmm. But they just, however hard I'm trying, they just don't seem to be able to. They just don't seem to be able to be. Well, they don't seem to be accepting it really, and they're not overtly saying stuff. I just feel that I'm not measuring up to what they want me to do. So it just there's that.
Is that one of the worries that you were talking about before? Is that one of the?
Oh, I got that. I put that on my sheet actually. That I'm not.
So what should we put down on our list for things to take account of today, to spend time with?
Well, there's worrying.
There's worrying. Okay, let's have that on.
But I don't know whether I'd be worrying as badly if I could do something about what they're like at work, and whether it's the time that whether I think they're being critical or whether they are being critical. I'm not sure. But it just seems that however hard I try, I don't seem to be able to be doing what they want me to do. And I guess that.
And is that the same with Tom and Janice? Is there a similar theme there about worrying if they are being critical?
I'm not sure they're being critical. I think they're just being. I think they're just being slight. They might be being slightly thoughtless, and I just don't feel able to say anything about it because they. Mm-hmm. I mean, in a sense, I know it's his home, and I know he's got to settle back in, and I want him to be welcome. I want him to be there, and I want him to know that I'm quite happy with him being there. But the way he behaves just makes it so difficult for me to keep a hold on things. So I get all anxious and worked up, and then I can't see anything's in proportion. So then I start worrying about the work thing again, and then that goes back onto my mind.
So there's lots of worrying that we need to pay attention to. But I'm just wondering whether there's something else there about feeling you've got to do what other people want. Is that what you were?
Well, I think there is. I think there is at work. I certainly think there is at work, and I suppose there is with Derek, because Derek thinks now that I've gone back to work again. He kind of seems to think if I just get on with it and put the worrying aside, that then things would be all right. And I obviously am trying to put the worrying aside. And I know what we've discussed, and I am trying not to do it. But it's just, I just feel with Derek that I'm letting him down if I don't try harder, and that it just seems that if I do get anxious and worried, then he gets upset, and I really hate having him upset as well, especially when Tom's around, because Tom then worries about how we are at home, and his girlfriend's really nice. Tom's girlfriend is really nice.
So you're trying to keep everyone happy. Is that what it's about?
Well, it is part. Yes, it is partly. It is partly to do with that.
Would you like to put it in slightly different words that fit for you? You've got to do what people want. You've got to keep them happy. That sort of ballpark.
Well, it's something to do with. I worry that if I do what I want, if I did what I wanted, then they'd be upset. It's something like that.
So what I'm writing down is doing what you want will upset others.
And it just makes me feel tense thinking about it, actually.
Does it?
Yeah, it does. Makes my shoulders ache.
I mean, that
Yeah.
sounds as if it's a really important one. Would you like us to spend some time thinking about how that affects you? And what to do
Well,
about
there is.
it?
Well, there is that, but I think the worrying is the big thing is that I can't get on with things because of worrying. I'm
Okay.
continually getting distracted by that, really.
Okay.
And
and
I
then
think
there.
it is related to the other, but I just get.
So what I've put down is the worrying, and doing what you want will upset other people. Will that remind you of what that's about? And then there were things about Tom and things about work. Should we have both of those on today, or do you think we've got enough?
Well, I think the thing about Tom, I think, is trying to. I think when he carries on as he is, it's really quite difficult for me to not get worked up and pressured by it. But I don't know how. But then I don't know what to do about it because of worrying about upsetting him. And I just kind of feel backed into a corner with it, really, because if I go one way, I'm all pressured and upset. And if I go the other way, then I get worried in case I'm upset
So
him.
it really links with the other problems, doesn't it? I'm going to put it down for the moment, and we can see whether it comes up. Now, there was something in the back of my mind from last week too, which I thought might be important to think about, and you did mention it earlier, and that was about the sense that you're feeling criticised by Sarah, for instance. And sometimes, you know, when Derek was asking you to do things, there was a sense, I wondered if that was a central issue that we ought to come back to.
Well, it was certainly one of the things at work that's got me.
Okay, so we'll have
That's
that
got me.
there too. It's rather a lot, isn't it? Now, if we look at that, do you want to have a look at the things that I've written down? Do you know which is the most important, or which one you'd like to focus on first?
I think it is the worry. I think it is the worrying.
Okay.
And I think the other ones. I mean, I think the other ones feed into it because they get me worked up, and I know that makes the worrying worse.
And you know what we've left off there too is you were going to do some work on the worrying for your assignment.
Yes,
weren't
yes,
you?
I have. I made some notes on that.
Okay.
So that.
So
But it's all to do with the worrying, really.
Is it?
Mm.
Okay, so you've said you'd like to start with the worrying, and that will allow us to bring in the thought records too, which you've been working on. So how does that seem? How does that feel to you?
No, I think that would be useful.
Excellent. Okay, it seems useful to me too, I have to say. Having watched the demonstration, what I want you to think about here is the general aim of what we're doing, which is to do the work collaboratively. And of course this raises some really important questions about how do you judge collaboration. And one of the things I want to encourage you to do is to think about how you do that for yourself. Some of the criteria you might use are things like thinking who did most of the work, or who did the work. Were both parties working or were they not? Or who was in control? Who made the decisions? Now these are things that it's very hard to judge moment to moment. It's more important to judge after a certain section of time has gone past. So I would suggest that when you're learning to think about your own ability to work collaboratively, that you should actually make some recordings of your own therapy tapes and listen back and judge yourself. And then you may also be able to think about what you think are the main criteria for collaborativeness. And they may, of course, differ according to the kind of client that you're working with. So let's go back to the aims of what we were trying to do during that demonstration. We were aiming to work collaboratively. We were also trying to find a way of setting an agenda with which I felt comfortable, with which the client felt comfortable. And that's, again, one of the general aims that you should have, to try and find a way of doing this that you like, that feels right for you. There's no one right way. There's no point in reading a rule book and deciding to do it exactly like that says. You need to be able to do it fluently in a way that makes sense to you. And then you are able also to respond flexibly to the things that people like or don't like about the way that you're doing it. Because people have many different kinds of preferences. So here are some of the questions that it would be really important to consider when you're thinking about setting your agenda. So how do you begin? Do you actually get into conversation with somebody and then interrupt that? and say, let's set our agenda? Or do you do something quite else? Now, you will find in the resources that I've made available to you a set of questions that could be prompts for setting the agenda that you can look at another time. But one of the main questions to be thinking about is, what language do you use? Many people don't like the language of agendas, do they? So one might say, what should we put on our list to talk about? Or what have you got on your mind today? What are the main things that we need to spend time on? But it's really important to use language that makes sense to the person you're working with. Next question is, how do you both remember what's been decided? Now, what we did in the video was write that down. And then I showed what I'd written to Ellen so that we could look at it together. And sometimes working in a room with a whiteboard, I might use that, or I might ask my client to write it down, and then I would share the list with her or him. So you need to think about what works best for you. Then you need to think who chooses what to start with. Sometimes there are some items on the agenda that seem extremely important to the therapist, but they may not have such importance, or they may not seem so essential at that particular time to the client. So I think the most usual thing to do is to ask the client, where would you like to start? And then, of course, if that item seems to you to be less central than something else, one might spend less time on it and move on to something else. So that leads into thinking how you divide up the time. Now, some people suggest when you're agenda setting that it's important to think how much time to allocate to the main items that you've put on your agenda. I find this quite artificial. I find it very difficult to do and difficult to remember. But I know some people do it and do it effectively. So again, that's a choice that you have as a therapist. And indeed to fit with what works with you and your particular client. The last question there, should there always be items from both people? Now, I think if you're working collaboratively, of course there should be. There should always be something that both of you want to bring to the agenda. Now, sometimes a client will come in with all sorts of appropriate things to put on the agenda, and I will still be thinking in terms of the formulation, where is the next step? Where is the next cognitive focus for both of us? So I might suggest something that goes in addition to that. And if it doesn't seem important to the client, it doesn't matter. But the point is that we're both working together at this particular stage. And we're making links with formulation work. That means that while somebody is talking and telling me about the issues that are relevant for them to today, what I'm doing is listening for their thoughts. I'm listening for the cognitions, for the themes that keep coming up, for the attitudes, for the patterns that maintain their particular difficulties. So I'm formulating as I go, and I think that's a habit it's quite difficult to develop, but I also think it really helps at this particular stage of agenda setting. Then, of course, you're making guesses when you're doing that. You need to find out whether you have understood the meaning of what people have said correctly, so you need to check it out with person. And then when you're checking something out, it's really important to know whether they're able to tell you whether you were wrong as well as whether you were right. Because some people find it very easy to agree with their therapist, as I'm sure you know. So we need to be able to be sure that the person is able to say, maybe, but maybe not, and then we can think again. Okay? And one other guideline is that when the thoughts or the cognitions at any level that somebody has actually expressed are associated with strong feelings, then that's an indicator that they're likely to be really important ones for one to be working on. Therefore, they should probably be on the agenda. That the presence of the emotion tells you that it's probably an important one to be paying attention to. Let's think of an example that you will have watched from the video. This is when I was thinking, as Ellen was talking, what's this all about? What's this all meaning? And I said to her, something about, I've got the feeling that you've got to do what other people want. I said it in a questioning way, but she wasn't quite happy with that, so we discussed it a bit further. And I tried again. I said, was it about trying to keep everyone happy? And that wasn't quite right either. And in the end, I asked her if she could put it in her own words, and she said, if I did what I wanted, they'd be upset. And when I asked her about her feelings, she said she felt tense and she had that aching feeling in her shoulders. So that's what we have on our agenda. And then in the back of my mind, I'm also thinking, does this link up with her underlying sense of having always been criticised and the sense that she is being criticised, hence the last item that we had on the agenda? So a summary of this section to cover the main points that I think are really important. Sessions should start with setting an agenda. There's no way out of it. Old habits die hard. We need to come back to setting an agenda. To ensure that the work is shared, the agenda should be set collaboratively. And in fact, if you listen to the style with which an agenda is set, it'll give you a fairly good indication of the degree of collaboration between the two people working together. Then the agenda that you arrive at should be manageable, so you don't have too many things on the agenda. Doesn't matter if you have too little, something else will always come up. But having too many just adds to the confusion, and what we're trying to do here is work in a very organized and structured way to model that so that somebody can use it in future problem solving. And then lastly, therapists should be aware of cognition of thoughts at all levels when setting the agenda, keeping the formulation in mind. It really helps to provide a guide to what are going to be the most fruitful items on the agenda.